All right, I'm going to get right into things here. So again, my name is Kirsten. Thank you so much for joining me today. I'm very excited to be chatting with you guys about return to work and navigating return to work barriers. Just a little bit about who TextMed is. We are a proudly Canadian company. We were started by an accountant over 30 years ago, and we assist with disability management and return to work planning for companies all across Canada, all different sizes, and we work to mitigate claims costs with the workers' compensation and manage employees' absences as well. And last year, we were honored to win the Canadian HR Reporters Reader's Choice Award for Best Disability Management Consultant, and we're very proud to be an allied partner of MSA BC. Just a bit about myself. Lisa gave a brief introduction. Again, my name is Kirsten. I am very passionate about disability management and return to work. I do have experience working with the Alberta Board as an adjudicator, a case manager, helping with policies, an early adapter for different programs that were being rolled out. And I started here as a return to work coordinator, and I am now happy to be managing an amazing team of return to work coordinators that help injured workers and assist employers with return to work planning. So a few items on the agenda for today. Just going to go over them with you guys. First and foremost, why is return to work important? What an effective return to work plan looks like. Common return to work challenges and solutions. So there are some themes with barriers that come up, whether that be modified work or injured worker participation. So we'll go over a couple of kind of trends that we see and how we can overcome those barriers, provide a little bit of solutions there for you guys. We'll do a bit of a deeper examination on mental health claims or psychological injuries. And then we will close out with some questions and answers. Perfect. So a little bit about just an introduction here on why return to work is important in general. First and foremost, there are numerous consequences to prolonged employee absence. Perhaps one of the most important or influential consequences of prolonged absence would be increased premiums. So the more time loss claims that you have, the higher your premiums are going to go. On average, every $1 in WCB or WorkSafe BC costs can result in additional $3 of premiums paid over the next following 3 years. So each claim that incurs costs impact your premium for the next 3 years. So time loss claims, severe injuries, those are the one of the biggest impacts that you can face when navigating return to work. There's a bit of an increased administration aspect of things as well. So if a worker is absent, there's immediately work to be done by other staff or departments. There's paperwork, there's phone calls, we're sending our Form 7s into WCB, we're emailing, HR has to coordinate things. So this is time and effort that could be focused on directly contributing to the success of your business, really. There can be decreased productivity. So not only is the workplace down the productivity of that absent worker, but there's often a rippling effect as well to the other departments as staff shuffle around. We're trying to fill the gap. They might not be prepared or trained for that specific position. So this is going to have an impact on the overall productivity of your business. Employee disengagement. So the longer, as previously noted by Lisa, the longer a worker is off work, the less likely they are to ever return. Workers who are off work typically have very few avenues to stay connected to their workplace, their colleagues, and the culture. This can lead to low motivation or even resignation. So we'll get to this a little bit later, but as a business and as a company, showing that you are invested in return to work programming, you're invested in assisting your workers with a safe but quick return to work, really helps with culture and morale. And it shows the other employees that if they happen to get injured, which is an accident, that you'll be supported and you'll support them in their return to work. So a couple of but again, on why return to work is important. Effective return to work strategies that benefit both employees and their employers. Number one being, again, mitigating the claims costs. So someone who is off work for a work-related injury or illness may be entitled to wage loss benefits, again, from WCB, as we know, or WorkSafe BC, pardon me. The costs are attributed to your WorkSafe BC account, which then, again, directly impacts the premiums that you pay. So getting employees back to work as soon as possible, given the nature of their injuries or what their current restrictions and limitations are. We'll work around that a little bit later on. But this will, again, cut down on the cost of the claim since there will be less time lost paid out by the board. As mentioned, the productivity can also take a big hit when a staff member is unexpectedly absent. Keeping employees at work is, of course, the greatest way to ensure productivity is not negatively impacted. And then you're fulfilling your legal obligations, pardon me, as well. All employers are legally obligated to accommodate disabled workers, not only according to the workers' compensation legislation, but to the Human Rights Code of Canada, which protects against discrimination on the basis of disability. So we have seen some legislative changes coming kind of down the pipe here in terms of our duty to cooperate, accommodate, and also the worker now, the injured workers need to fulfill a duty to cooperate with employers as well. So we're hoping to see a bit of changes there in terms of barriers with engagement or communication and a little bit of support from WCB or WorkSafe BC there. Now, I touched on this a little bit before, but employee benefits. So we know that when someone is injured, they're receiving wage loss benefits for a compensable injury. They're getting paid less than their full salary. So wage replacement benefits, again, they're not 100% of a worker's regular earnings. So having them back to work quickly, whether that be full duties or modified duties, means there's less financial instability for the worker. We don't want to create any financial hardship for the worker, and it might be 90%, but that can make a big difference for someone that might be living paycheck to paycheck, right? So again, that financial factor and mitigating any financial concerns for the worker is a big benefit. Most people will probably say that they appreciate routine and consistency in their day-to-day lives. Many workers we speak to mention the frustration of feeling useless, bored, restless. When you're all of a sudden removed from your workplace and that environment, especially if you have a good culture and that working relationship with your colleagues, having that removed can really negatively impact someone physically and mentally. So having them return to the workplace, even if it's not at their regular duties, is going to significantly support keeping them on that routine, keeping them engaged. And again, it's showing them that you are willing to support an injured worker during their time of need. And again, quicker recovery. Oh, I'm frozen here. So the quicker that we are going to get a worker back to work, the probability that they are going to stay at work is going to be a little bit higher. So we can look into programming, modified work. It's showing that if a worker does return to modified work, they do have a quicker recovery. So again, physical and mental aspect to having an effective return to work plan for your workers. So going over what to do in the event of an illness or injury. Just a bit of a slide here. So number one, first and foremost, be prepared. And be prepared means before an injury occurs. This happens, at your toolbox talks or your staff meetings. This happens at the onset of someone's employment or while they're onboarding. Having an established set of procedures with relevant parties educated and prepared to adhere to the process, including all employees, is vital. Every member of your staff should know what's expected of them in case of an accident. So who do they tell? If it's not a acute severe injury, right? If they have a musculoskeletal injury, who do we tell? What paperwork needs to be filled out? There should be posters around your lunchroom, what to do. So the expectation is set. And right off the bat, we're mitigating any barriers with communication or what is expected from both the employer and the employee. Next, we ensure the medical stability. So again, if the most pressing step post-incident is to ensure the worker receives medical care they need, if it's a more significant injury, a head injury, a concussion, a fracture, what have you, the time frame for going over paperwork and offering modified duties is going to be adjusted a little bit. However, if it's a less severe injury and they're able to ambulate, or it looks like there's going to be potential of modified work, then we're going to reiterate those expectations right then. Next, reiterate the expectations. Well, you should have laid the foundation of the return to work process with general training. Make sure, as I stated previously, to reiterate exactly what is needed from the injured worker, outline what they should expect from you as their employer. And the more familiar the employee is with what's going to happen in the coming days or weeks, the more smoothly the return to work process is going to go. And you might even get some more buy-in, really. If they know what's expected from them, there's no surprises. It's just pretty much status quo. Next, offer modified duties. So you don't need to wait until after the doctor has seen after the worker has seen a doctor to offer modified duties. We can make offers based on what we would call common sense restrictions based on the nature of the injury or the part of body that is injured. So for example, a lower back sprain, which is quite a common injury that we see. The worker might not be able to get into their doctor right away. They might not have a clinic near them, or they're not taking patients for the rest of the day. So we're not going to know what the actual medical restrictions and limitations are for a little bit. But we know that with a lower back sprain, we're going to likely receive some medical documentation in advocating that the worker limit their lifting, their pushing, pulling, their bending. You might want to offer duties that limit the need to walk on uneven ground. We can get them taking micro breaks as needed, allow them to sit and stand and stretch, right? So we can look into our modified duties pool that we should already have as part of our return to work package and process, and say, okay, Mr. Smith has injured his lower back. We don't have medical yet. However, we have these modified duties available that generally work for this part of body. Let's get them offered now and have that discussion with the worker. Then we're going to be reporting to WorkSafe BC. So in BC, you have 72 hours to report a claim to the board, unless it is a fatality. Fatalities need to be called in right away as soon as you can. There's a special line for them, which you can find on the website, but more severe traumatic injuries need to be reported right away. For the less traumatic or severe injuries, you have 72 hours if it meets criteria. So a claim, what you need to report to WorkSafe BC would be if the worker needs medical attention beyond first aid, if they require any amount of time off, or if they intend to seek medical treatment for the injury. Right then and there, we're going to be reporting it to WorkSafe BC. Medical reassessment. So once the worker returns from their initial medical assessment, they should have some objective limitations or restrictions outlined, again, by their care provider. At this point, we can review the modified duties that we had already offered and make adjustments as needed, or they might have restrictions, limitations that allow them to do a little bit more, maybe work within a medium level category, and we can amend the plan as needed. But a solid return to work plan would have an offer made on common sense restrictions right off the bat, because that's going to turn the tap off. If you think of a claim, I guess you can say worst case scenario, it would be immediate time loss. If you are going to get ahead of the game and offer those modified duties, it turns the tap off right away for that lost time, again, which is going to impact your premiums. It's going to impact all sorts of areas across your business. And then we're going to continue with regular communication, which should be set as an expectation for the worker anyways. The remainder of the claim will likely consist of regular check-ins, reviewing updated medical restrictions. We'll want to create a plan that outlines what duties or tasks the worker can perform according to what their care provider has indicated that they can or cannot do. Creating the plans for 1 or 2 weeks at a time and sharing it with the worker will help keep everyone on the same page. And it's also important to note that these plans should be progressive in nature, right? So if we have someone working lifting up to 10 pounds for the initial 2 weeks, we anticipate if they are progressing as per, we would use ODG guidelines, but we should see them be able to kind of move more, they're less sore, they should be able to lift perhaps 15 to 20 pounds. So it's important to keep that in mind and keep an eye that they are progressing as anticipated, because if they're not, that's a barrier that we'll speak about a little bit later that we can address as well. So I got a little bit into this already about what an effective return to work plan looks like, but this just kind of sums it up in a succinct little way for you guys. It would be beneficial. There are templates and there are notes on the WorkSafe BC website on how you as a company can create your own return to work plan based on the industry that you might be in or different factors that might kind of change for your specific situation. But again, to reiterate the importance of the immediate offer of modified work based on common sense restrictions. If shoulders are also a common part of body that is going to be injured. So if they're saying, you know, a specific incident or a chronic or a gradual onset is occurring, right away, we're going to say, okay, let's get you doing one-handed duties. We're going to limit your pushing, pulling. They're not going to be sweeping or mopping or anything that would aggravate the shoulder. And then we're going to help them find some medical care after following the initial assessments and going over the potential modified work that we have. Modified work can be gradual hours, modified shift schedule if needed. So again, they don't need to come back to work right away. Sometimes you get, if an injured worker has a bit of a disability mindset, it might be beneficial to offer half days. We can say you can work 4 hours Monday, Tuesday, 5 hours Wednesday, Thursday, 6 hours Friday. It doesn't have to be right back into their full hours. Regular medical updates. We require medical every 2 weeks. Most of the time, this would be with a treatment provider like a physiotherapist, or they might be seeing a chiropractor, and then their GP as well. Consistent communication, again, number one with the worker, they need to feel like they're being supported. We have an obligation to remain in communication and cooperate with the worker just like they do with us. So that is very important. And then lastly here, continuing efforts even when the worker is back to modified duties to mitigate the risk of regression. So they might need to self-limit a little bit or just be careful. They might have a coworker by their side when they're doing heavier lifting, but just ensuring that you're seeing that plan all the way through is important.
Excellent, Kirsten. Let's just take a short pause here to dive a little bit deeper into what an effective return to work policy and program looks like. I know in our sector, many of our members are wondering, how does an employer know what modified duties to offer, especially when some of these lighter tasks may be reserved in a rotation on a line to allow for a rest spot for workers? And what if an employer doesn't have any designated modified duties? Can you expand a little bit upon that?
Sure. So if you cannot identify any modified duties right off the bat, we can anticipate that as the worker progresses through their treatment, that their restrictions, limitations, again, will be improving. So while you might not have a pool of modified duties that's suitable in the first week or two, we can expect that as they progress with their treatment and as their restrictions, limitations lessen, that we will have more duties that we can offer from the modified duties that we've already kind of planned for. Now, if another thing you can do, it's interesting, it depends on the industry you're in. So if you are a convenience store or if you are food processing, you can connect with other people within the same industry to see what they have that they might have thought been a little bit more creative, thought outside the box. They might have had a claim where that was really tricky, where they put a lot of effort into, and they might have developed some interesting or unique modified duties based on that industry. So connecting peer to peer within your industry can be quite beneficial as well. And then you can also look into, obviously, the support of WorkSafe BC, having those conversations with the adjudicator or the case manager on the claim. You can ask for an occupational therapist to come out to site for perhaps a mini job site visit, and they can identify, their job is to identify suitable duties within the work environment. But again, it depends on what those restrictions and limitations are, what part of body is hurt, the nature of the injury, the severity of the claim. So there's a lot of medical factors that we need to consider before we can kind of relate the appropriate modified duties over the course of the next couple of weeks.
Excellent, Kirsten. Thank you. Look forward to more slides. Thank you.
Perfect. So getting into a little bit of some common challenges that we see when we are assisting with a return to work. If it were as simple as following a checklist or a step-by-step instructions, disability management experts like TextMed would not exist. So there are some nuances or some tricky situations that we can prepare for, and again, some common trends that we see with barriers when you're approaching a return to work for a worker. Getting into some physical challenges here. Difficulties identifying modified duties. Again, I just spoke to that. So we have the option of peer-to-peer, just to reiterate, peer-to-peer interactions within your industry, having that conversation with the case manager or the adjudicator. They might have some ideas from their experience. Can an occupational therapist come out for a job site visit? Oftentimes, though, people forget that the injured worker themselves is such an important resource because they are the ones working every day, doing their frontline work, working, the daily tasks required of them. They actually might have some really good ideas on how they can modify their job demands to be able to return to work. So it's super important and highly recommended to open it up to the worker as well, if they're willing and they're engaged, to strategize on how you can modify their work so that they can return earlier and safer. Doctor's notes. Oops. Sorry, doctor's notes. Again, medical barriers. We see this all the time. There is on the next slide. I got ahead of myself because I'm very excited about this, very passionate. So I got a bit of ahead of myself. So I'll just highlight these. Doctor's notes, worsening condition. So if they are not if they're not progressing as anticipated based on the nature of their injury, we often refer to official disability guidelines to guide us with the medical aspect and what we can anticipate for recovery for our workers. So if we're seeing they're going to physiotherapy, if they've been in there for 4 weeks and they're still limited to lifting less than 5 pounds, we know right away that we need to kind of pivot here and get some other resources available, or other resources kind of on deck here to assess the worker's plan. And then medication side effects or restrictions. There we go. So got ahead of myself here. So again, speak with the worker, consider a site visit by an occupational therapist, and get creative. Doctor's note. So prepare for medical reassessment, maintain communication. Sometimes it might be beneficial just to do a bit of the legwork up front and perhaps take a peek at what walk-in clinics you have near your job site, and then give them a quick call. I've done this for a few clients, reaching out to medical providers around the area that might partner with your company, or they do take WCB claims or WorkSafe claims, pardon me, because not everyone does. So medical assessment is a bit tricky at times. They can go to the hospital. We're likely not going to get a very good report from a hospital for a less severe injury. Obviously, if they need a hospital assessment, go right there. But hospitals or doctors oftentimes will just provide a note that says worker injured for needs to be off work for 3 weeks, and there's no information for us to work on. How much can they lift? Can they do sedentary work? We need more meat on what their functionality actually is, so we can get some modified work, get creative with our modified work. So I would encourage that we maintain communication with our medical providers for injured workers to get a bigger picture and not just off work, off work, off work. Worsening condition, again, if you have a lower back sprain and the injured worker has been attending physiotherapy for a number of weeks now and you're not seeing any progress, we're going to have to hop on the phone. We're going to have to get in touch with WorkSafe BC and say, listen here, do we need a medical status exam? Do we need a functional capacity evaluation? Do we need to get some return to work support services in place here? Do they need an OR program? There are so many options available when we need to pivot on the claim if our worker is not progressing as we would like to see or as medically supported. And then again, we might have to review their modified duties. Perhaps they're working in a bit of a heavier capacity than they should be. But there are tons of options available to address barriers when our worker is not progressing as we would like to see or their condition is worsening. And again, medication side effects or restrictions. This one will have to work. It's a little bit tricky because Side effects I've seen in the past, side effects can impact injured workers' ability to drive heavy duty machinery. It makes them drowsy. They shouldn't be driving. So that's a tough barrier to find solutions. We can maybe offer some work from home or some online training, things like that. But if they can't drive, we're going to have to wait until they're not less acute and their medication, they're weaning off it a little bit. But again, take a peek at the modified duties, reassess as needed. And then once we can connect with their medical provider again, we'll have a better understanding of how long they'll be on the medication and what the plan is after that. And a bit on logistical challenges here. So lack of participation or no communication from the worker, a barrier or a lack of transportation, no family doctor or a long wait for medical, and workers making appointments during working hours, which actually happens way more than you would think. It's a daily conversation. So in terms of no communication from the worker, we can go back, obviously confirm their contact information. Do they prefer to communicate via text? Are they perhaps younger and don't want to pick up the phone and they would rather text or email? Attempting different methods, and then seeking assistance from WorkSafe BC. If you're reaching out, it's radio silence. We're going to have to get WorkSafe BC on the phone and convey our communication concerns, because again, just like we have an obligation to cooperate in the return to work process, the worker does as well. Lack of transportation, so we can privately ask some nearby coworkers. We can look into arranging a taxi or an Uber. Oftentimes, WorkSafe BC will assist with transportation, but that's going to be an added cost onto your claim. So if you would like to look into offering taxi, especially if they're working 3 days a week instead of 5, the cost of the taxi to get to work is probably going to be worth it, because you're going to be limiting those hours that they're working modified. So if someone is working an 8-hour shift, they're only able to work for 4, but they can't drive, and you say, okay, we'll cab you in. You're saving that 4 hours of lost time. So it's important. If that's the only barrier for them returning to modified duties, very worth it to try and find some solutions like a taxi, an Uber, co-workers, carpooling, things like that. No family doctor, long wait for medical. Something that's been really useful in the past has been virtual health assessments. So when COVID hit, a lot of providers switched to telehealth or virtual health appointments. Oftentimes we see this with remote workers as well. If it's a 45-minute drive to the closest physiotherapy clinic, we can work with them to get to that initial assessment, build a really solid home exercise program, and then have weekly virtual health appointments with their physiotherapist following that. And again, I mentioned doing the legwork up front. What clinics are near you? What clinics accept walk-in patients without a phone call? Which clinics need a phone call? What are their hours? Are they closed at lunch? How many doctors do they have? Do they take WorkSafe claims? So scoping out your community around your job sites might be quite beneficial in mitigating this specific barrier. So we can say, you know what, your family doctor might not be able to get you in for 3 weeks, but we have this list of clinics for you that are more than willing to take you. Let us know if we can help you. Things like that. And then appointments during working hours. This one gets me. Speak to the worker, have a conversation. You might need to adjust their hours. So if they're an 8 to 4 or a 9 to 5 worker, do they want to work 7 to 3? We need to keep in mind that we need to be a bit flexible, because they might have kids. They might have obligations after or before work. So if they cannot attend their appointments, can we shift a little bit 7 to 3 so they can go at 3 o'clock till 4 o'clock? Sometimes it happens. We can talk about the wage loss with WorkSafe BC, but the expectation that the board, that WorkSafe BC will reiterate, is that they are supposed to be making appointments outside of working hours as well. 1 or 2 times, I wouldn't suspect it to be a big deal, but if they are constantly leaving for 3-hour chunks, then we're going to place a call to the worker, going to place a call to the adjudicator or the case manager, and try and have that conversation to offer options that are outside of working hours, depending on what their specific circumstances might be. Now, getting into psychological injury claims. These ones can be a little bit there could be a perception that they are a little bit scarier, right? It's a psychological injury. There's not it's a little bit different than someone breaking their arm or spraining their back. But really, the process is often the exact same as a physical injury. So we'll go over the stigma and the fear of judgment on the worker's behalf, bullying and harassment by other workers, and then the sensitive nature of the claims. Now, going over the stigma and the fear of judgment, we're going to get ahead of this, again, by educating ourselves and providing that proactive education. We're going to be, sympathetic, empathetic, demonstrate understanding, but the legwork here is to know what constitutes a psychological claims through WorkSafe BC, things that are covered, things that are not covered, and just, again, we've talked earlier about having a return to work plan and how that makes your worker feel engaged and supported. It's the same thing with a mental health claim or a psychological injury claim. Bullying and harassment is a bit different. So we have psychological claims. We can see psychological injuries coming from paramedics or police officers, firefighters, people that are exposed to these traumatic situations every single day. The board will presume that their psychological condition is related to their job, which is pretty understandable. Bullying and harassment claims are actually a little bit different than psychological claims. They often need a lengthy investigation. And there's actually a requirement to perform an internal investigation when a bullying and harassment claim comes up, which WCB will then utilize to conduct their investigation. They're going to do a very lengthy there's going to be a lot of phone calls, a lot of back and forth, a lot of evidence, but your due diligence in performing your internal investigation is going to be required, and you must have proper policies and procedures in place for your workplace, specifically relating to bullying and harassment claims. Now, I saw on WorkSafe BC, or I've seen before, that there is a site or a page specifically tailored to creating a toolkit with templates and fact sheets on how to address bullying and harassment allegations or claims from workers. So I would really encourage you to check that out and make sure you're prepared right off the bat. Educate yourself so that as barriers might come up, you're already prepared to mitigate those. So yeah, speaking with the worker, separate implicated parties, correct inappropriate behavior. When a claim comes forward for either a psychological injury or a bullying harassment claim from a worker, you're going to right away try and mitigate any of the triggers or what have you in terms of modified work. Do we need to separate two parties? Do we need to remove someone altogether from this site and put them in the office? How can we work with them to show A, that we're really supportive, and B, that we are able to modify their job in a way that we can have them still connected to the workplace while the internal investigation and treatment, the external and internal investigations occur with WCB and yourselves. And lastly, the sensitive nature of the claim. So keep on regular communication, remind the worker of their treatment options. There are so many different ways that people can overcome or address their psychological injury claims based on, what the diagnosis is. And just making sure that you're not ignoring them, right? That might be awkward, we need to, even though it's a bit awkward, or it could be perceived as being a bit awkward, we still need to have those regular check-ins. Hey, how are you doing? What can we do for you? Are you ready for a return to work? Things like that. It's going to go a long way in that maintaining that relationship with your injured worker. So the nuance of mental health or psychological injury claims. We just wanted to quickly add some additional information regarding mental health or psychological injury claims in particular, since these are increasingly prevalent and also present very unique challenges for employers. Businesses often feel paralyzed and unsure about what to do for mental health claims, but at the end of the day, they're largely treated the same as any other injury or illness, and you're likely right on track. So we're going to be getting actual restrictions and limitations just as we would for a physical injury. And then we take it from there. Modified work might present as a little bit more of a barrier because it's not just limiting your lifting, right? It's a psychological injury. So we might have to get a little bit more creative, but we have lots of supports in place through WorkSafe BC, which can assist with this. So mental illness, reviewing it as a treatable medical condition. These are actual neurological disorders. They're quite common, and we're all human, right? Mental health issues in the workplace should be handled the same as physical health concern. It's not the employee's fault. Again, accidents happen. Evaluate the condition, what the condition means in regards to the employee's ability to perform their job duties, and if necessary, offer accommodations or alternate duties that respect the employee's limitations.
Really great information, Kirsten, and thank you for taking the time to highlight the nuances around mental health claims. It's not easy at times to navigate, these types of claims that have more sensitivity associated with them. How much information can an employer request regarding these types of claims? Are there any limitations around the types of questions they can ask? Can you talk a little bit about that?
Yeah, so essentially, the same as a physical injury claim, we are privy to know what their restrictions and their limitations are. If you think about it, knowing an actual diagnosis doesn't really impact or influence your return to work plan. You're building your return to work plan and your modified duties based on what they physically or psychologically can and can't do. So we're not really privy to, and for the interest of the worker, for FOIP, for their own privacy, we're not able to know what the actual diagnosis is. However, we know what they can and cannot do, and we can modify our workplace to work with them and offer those duties that will progress them back to full duties. So it's a bit important to highlight too for bullying and harassment claims. Different sectors within WorkSafe BC cannot share information with each other because of FOIP. So you might be getting the same questions coming from different people. So just a heads up on that. They also highly respect the workers' privacy, and they don't share sometimes they don't share internal information depending on the nature of the claim.
Excellent. Thank you for helping us. And there's lots of questions coming in. So really looking
forward.
Well, it's good. I mean, it's getting it, and that's how we learn. So looking forward to being able to get to your question later in the presentation. So thank you, Kirsten.
Thank you. So continuing on with a psychological injury or a mental health claim, some things that we should be doing that we've highlighted a little bit thus far. So focus on the objective limitations and restrictions in regards to their work. This is the exact same as a physical injury, right? Remove them from identified mental health triggers. Inform them of possible accommodations or alternate duties right away, providing that support right off the bat, not only because we care about our workers, but also this is impacting from a financial and employer side, right? We're turning off that time lost potentially, and there's a business side of things. So it's a delicate balance as a business for you guys. And meeting with them regularly to understand the progress of ongoing barriers, remind them of the benefits available to them right off the bat. Our employees, it's oftentimes when we're facing a psychological barrier, it's hard to think a little bit outside the box. So highlighting if you have an EAP, do you have other potential psychological resources through your benefit that you can offer right away while the claim's getting adjudicated or what have you? That's important to offer to your employees as well. And then things to try and avoid. Again, ignore the claim altogether for fear of upsetting them. Please don't do that. Ask or probe for a diagnosis. We don't need to know that. It's the worker's right. We are not required to know a diagnosis. It's not going to really change the return to work plan on our side. Do not dismiss their thoughts or feelings, utilizing a lot of listening, a lot of, empathy and sympathy for them. Do not accuse them of making things up or exaggerating things. Do not attempt to relate with personal anecdotes. Don't try and fix them. oftentimes people's natural response is to go into fixing mode. But with a psychological injury claim, we're going to leave that to the professionals, and we're going to, if it's a compensable claim, WCB is going to offer programs or exposure therapy or what have you to progress them back to hopefully their regular duties. So potential accommodations for mental health or psychological injury claims, which we've touched on a little bit, but again, distancing them from triggers, or if this is a claim that is stemming from like a chronic onset, or it's happened over time to witnessing multiple traumatic events, we perhaps can we pull them in to do some administrative support, taking them out of the field while we work on the compensable injury and progressing them back to their regular duties. Modified job duties, which again we'll have to be a little bit creative with psychological claims. A different approach to supervision, tailored training, schedule flexibility, and an alternate workspace or location, which is often going to be probably the best accommodation for a psychological injury or a bullying and harassment claim as well. And summary already. So communicate, substantiate, accommodate, and update. Easy to remember. Return to work planning can be simplified to the following. Communication. Before an incident even occurs, communication is key. Start with training, ready available resources, have a package ready. We need to ensure that not only ourselves as employers know how to handle a claim and what's expected of us, but also reiterate that to the worker. What is expected of them? A guide for everyone is going to ensure a smooth process, and that's really by having a solidified return to work plan in place right off the bat is going to eliminate potential barriers before it even happens, right? Staying appraised of the progress and updated limitations and restrictions means that we can adapt and offer modified duties as quickly as possible. So maintaining communication with our medical practitioners is very important. Successful accommodation, the key to successful accommodation is objective medical evidence. So everyone feels pain differently, but what we as employers need to take into consideration and what the board makes their decisions on is objective medical information. People can say it hurts, but we need to know how far can you lift? Can you reach above your head? Can you reach to your shoulder level? Can you bend below waist? Those are the types of questions that we need to be asking. So again, it opens the door for much more modified work opportunities instead of work remains off work greater than 13 days, greater than 21 days, right? We need to dig in and we need to get a better grasp on their functionality so we can see the ability and disability, which is what TextMed does. Accommodate. The absolute foundation of any return to work program offering appropriate modified duties that accommodate the workers' restrictions. Looking into accommodating workers any possible way, thinking outside the box, connecting with other people, using past claims as a learning opportunity on how you might have gotten really creative and identified other jobs that you might not have thought of. Working with WCB, having a job site visit, they're all great ways to ensure that we can build a bank of modified duties, and then we can offer based on the injured part of the body and the severity of the injury. And then updates, repeat as needed. When a worker is completely off work, you should be checking in at least once a week, requesting medical updates typically every 2 weeks in order to identify progress. And again, identify any barriers right off the bat. Like I said previously, if you're seeing they're not progressing as anticipated, or they're really struggling, they're kind of plateaued with lifting 10 pounds, we have to get some other resources on the claim here to overcome those medical barriers. Because oftentimes, if they are medically plateaued, they're frustrated, it can lead to perhaps some mental health barriers personally, not compensable, but mental health concerns, because they can feel useless, really. If you're used to getting up and going to work every single day and all of a sudden you're laid up on your couch for weeks, the motivation and the impact on your mental health can be quite severe. And that's that. So we will be, I'll see you at the Safety Alliance. Sorry, we are going to be make it safe as well. We're going to be in person. We're going to be virtual. And I look forward to seeing everyone there and answer any further questions.
Thank you, Kirsten, for sharing so much helpful information about how to navigate this challenging and quickly evolving area. Recognizing new legislation is coming into effect January 1st, but so it's more important than ever to know what we must do, but also it's the right thing to do to support
our That's right.
Successful, safe return to work. To our audience, if you have questions, please ask them. I'm going to jump right into them because how we apply some of this knowledge is really by answering some questions. So I'll get to as many as I can. So the first, really, if you have an immediate offer, you have immediate offer of modified duties, but then later the doctor's note puts them off work. What do you do? You know, especially if you're asking the doctor to fill a functional form in and need them to do that. You know, what are the steps to take to moving forward from that?
Yeah, in all fairness, the purpose of offering the modified work based on common sense restrictions is to, again, mitigate the potential lost time. But if they go to, if they accept, great, and then they go to a doctor and the injury is perhaps a little more severe than we thought, or it's like when you get in a car accident, you're obviously your adrenaline's going, but the days after that, you're so sore. So it's fair that if you offer those modified works and they accept, and then the medical opinion from their practitioner is differing, that's fair, right? So we would look into what period of time is recommended for that worker to be off of work. But the good thing is we'll already have some identified modified duties, right? So we're going to, again, we'll upload or we'll send that information, the initial offer of modified duties up over to WorkSafe BC. They can take it into consideration. It depends. Some of these are so claim specific, right? So if they've jammed their finger and they accepted one-handed modified work and they go to the doctor and the doctor says they need to be off for 2 weeks for a jammed finger, we're probably going to have a conversation with the case manager and reiterate our concerns and just say, listen, we have these duties that are so suitable. They're physically within keeping with, you know, what we anticipate them to be able to do with this type of injury.
How often would you communicate with the worker following that? Would you wait? You know, I mean, 2 weeks seems like a long time, or what would you suggest in that circumstance?
If the worker is off work, it depends again on the severity of the injury. If they have fractured their femur or something super traumatic like that, we know there's no return to work on the horizon for months if they're surgical. So checking in every couple of weeks, keeping that communication open is okay. If it's an injury that has an immediate return to work potential, it's a sprain strain, musculoskeletal type injury, once a week, it depends on the relationship, I suppose, that you have with the worker, but pop them an email every other day, call them once a week. If they're on modified duties, give them a shout, go through their plan. Hey, this is where your plan says you're at. How are you doing? When's your next doctor's appointment? We need to know these types of things, right? So the more, the better, I would say.
Excellent. Who decides modified duties for a return to work worker? And what if the supervisor just doesn't have, is not trained in medical, obviously, terminology as well. So does the super need the help of a professional to decide the modified duties? I mean, how does that relationship and understanding move forward?
Who decides the modified duties? Okay, so again, it would depend on what part of body is injured. Mm-hmm. And if we have medical, what that medical says they can do. So you as a company or you as an employer should work together to try and have those modified duties already pooled and identify what you have. I don't know necessarily anyone decides what you can and cannot offer, but oftentimes we'll actually send a list of our modified duties to the practitioners, and the practitioner will say, yeah, they can do that. No, they can't do that. And then the Workers' Compensation Board, WorkSafe BC, will also deem the offer appropriate or inappropriate. So there's lots of double checking. There's a second set of eyes, but we need to do our due diligence to at least get an offer on the table with what we either think we can do or offer depending on what the medical is.
So it's really also focusing on what they can do in relationship
to,
you know, what the duties offered kind of align with. Excellent.
For sure.
As an employer, how do we support and navigate workers pre-existing injuries that are exacerbated at work?
Oh boy.
And that can be a little more, because there's a bucket at times you may not know all those details. And what about injuries that happened at home or at a company event? I mean, these are, can you suggest a path forward in that circumstance?
So I could do a whole nother hour on pre-existing conditions and perhaps injuries occurring on lunch breaks, off-site, a company event. What I would encourage you to do is to hop on WorkSafe BC and educate yourself. There's policies and procedures written out. You can search it. You can search lunch break, non-occupational. You can search those keywords, and it will bring it right up for you, and it'll explain how they're going to adjudicate the claim, what the policy is, and then you can compare your notes, the specifics of your claim to their policy and kind of gain a bit of understanding. We often see like, well, the worker said they had a sore back and then they sprained it at work. There's a lot of nuances like that. But if there was a specific event at work, if they had a slip and trip, if they lifted a heavy tote, a specific event is likely going to be a compensable claim. If they have a pre-existing condition and that is going to lengthen their recovery, then we can look into a little bit of cost relief. But I really encourage, there's so much more to it. So if this is a claim specific question, I highly, highly encourage you to hop onto the policies and procedures. And there's also a whole page on facts and questions on pre-existing conditions as well, and how that's going to impact your claim. The good news is, on an employer side, if there's an identified pre-existing condition and the worker has received more than 10 weeks of wage loss, we can apply for relief of cost, which will, if accepted, then we can mitigate some of the lost time, the wages or the healthcare benefits and the accrued costs on the claim, and have those removed due to the pre-existing condition. Because I mean, employers shouldn't take the hit, right? We shouldn't be responsible if they already had a significant condition prior to getting injured.
And what we can do is we can add that resource link when we circulate this recording, just to help support all of our viewers here today. So knowing that'll be included in the package. Thank you for that recommendation, Kirsten. I know we're getting closer to the hour, but what could be some things that TextMed can do to help bring workers back to work or reduce claims cost? If the worker appears to have gone on vacation or out of town well off on an injury claim, is there anything that you can suggest? I know workplace culture plays a big part of, how do we create that environment where we not just having a return to work program when you have work-related injuries, but really there's a whole environment of making sure that we have that, a program in place.
That's right.
Or when you do have those injuries that happen outside of the workplace, right? I think that's all what we want to build.
That's right.
Helping people, right?
Yeah, and the key there is going to be how proactive you are. So I mentioned earlier having your posters. I know TextMed, we give our clients posters to have in their lunchrooms on what to do in the event of an injury. Having those ongoing safety meetings. Do you have an internal, OHS or, but I can't think of the word right now for the safety committee, right? But are we staying on top of the education? Are we talking about these things on a regular basis, even when it might not be needed? We might not have anyone on modified work right now. We might not be facing any injuries. However, it takes one little slip and trip, right? So empowering your workers to be successful ahead of time because they know what to do is so important.
Absolutely. No, and thank you again for joining us here today. Really, to everyone in our audience, thank you for sharing your questions. If we didn't get to your question, we'll do our best making sure to respond to them in the follow-up, and we'll certainly invite Kirsten to be able to do that and sharing the answers on the website for everyone to view. So thank you once again. Before we close, so reminders about, there are so many events coming up in this month as well as next. Next Tuesday already, September 19th, our next webinar will help you use the WorkSafe BC Employer Portal to access your employer's report card and other key health and safety planning tools to improve health and safety performance and reduce your insurance costs as well. So stay tuned next week. We still also have a few seats available next Thursday in Langley for a free workshop on mental wellness at work with Dr. Steve Conway, and really a great opportunity to meet somebody who's had so much experience, especially on the front lines in this area. So really inviting you to take the time to attend, a really exceptional opportunity for all of you if you can be there. If you're joining us today from Northern BC, sign up today for a free for members workshop day in Prince George on September 27th and a full day Joint Health and Safety Committee training class on September 28th. Learn more through our website and the links in the chat. We look forward to serving you up in our northern community. And then we're into October 4th, joining our allied partner, as Kirsten mentioned, TextMed Services, and some of our team for a celebration open house at their headquarters right here in our neighborhood in Chilliwack. Hopefully you can join us in person to learn more about disability management and return to work, make new connections with TextMed and the local safety community here, as well as win some prizes. So hopefully you can take that time or consider that opportunity as well. And then, of course, this fall, bringing your team for training, professional development, and connections as we explore what's driving world-class health, safety, and performance at our Make It Safe Vancouver, and that's on October 13th, and then online at the end of October. So we've extended the early bird deadline until next Friday. So please hurry up. They're going fast, and tickets are certainly selling out. So we really look forward to seeing you there. In person in October, mid-October, and then of course online at the end of the month. Visit us online anytime for help or to access our full library of webinars, resources, and training. Watch for an email tomorrow with a link to the recording of today's session, and of course a survey to share your feedback and topic ideas. Thank you once again for being part of our session today. Valuable information. Thank you to TextMed as well. Please take care, and of course, stay safe.